Okay, we are coming to the close of a day and a half of really vigorous conversation, and this panel will no doubt be just as vigorous. I am going to ask them also to reduce their comment time to 4 minutes. That is largely because I think there's a lot of energy in this room. We wanted this to be very participatory, that none of us who happen to sit up here are any more important than anyone else who's here. So I'm going to begin with Josie Briggs, and we introduced Josie before, so I'm going to have you go ahead.
4 minutes. Okay. Really wonderful meeting and many provocative ideas. It's clear that people recognize the NIH is doing quite a bit and that we could do more. And I found many useful ideas here. Certainly one thing that's very important at the NIH that I think many of the leadership are recognizing and exploiting, but more can be done, is partnership with patients, bringing the urgency patients feel around these issues, their access to other routes of getting information, and the fact that they have different concerns in the privacy arena, and that we need to be sensitive to those and build structures that can, that was certainly one area that was very important. This question about data ownership versus data rights, I found that the lawyer McHugh, I guess is her name, brought up, I thought was a very helpful point. I've also overseen data sets that were developed through CMS, the United States Renal Data System, and that was actually partly created for quality control, and if something bad happens to you in a dialysis unit, that information, in fact, without patient identifiers, can be shared. So there's some different rules around purely research versus quality, and that's sometimes a complex interface from a regulatory point of view. I also found the discussions about reproducibility incredibly important. There have been several we worry a lot about making sure that there's a general perception that our research is a good use of the taxpayer dollar. Very important concern for us. And there have been two areas in which there have been some recent challenges to that. One is a study by Joe Ross about how many studies didn't get published. My colleague and good friend Mike Lauer has looked at that again in NHLBI data, and he finds it's not quite as bad as the Ross sample looked like, but indeed we do have a problem of studies not getting published, and that's particularly true of smaller studies. Another big challenge has been the questions of two industry studies and then some studies from people in cognitive psychology about reproducibility issues. And part of these are of big concern, and the discussion here about sharing data, I personally view as part of the fix for reproducibility. I oversee and have overseen for a number of years clinical trials, and I think we end up with very good data sets from these very carefully managed NIH clinical trials. We do often end up in give and take about the interpretation. And some of the reproducibility issues don't involve the actual quality of the data, but the interpretation of the data. And by making sure that the data sets are available for other people to talk about, play with, and work on, I think some of the complexities and lack of reproducibility issues may, over time, get resolved. So anyway, very provocative, very helpful meeting.